pharmacological class of sumatriptan. Sumatriptan is a selective serotonin receptor agonist. It is a class of drugs that stimulate the central nervous system's serotonin receptors. It selectively binds to 5-HT1 receptor agonists in the brain's blood vessels. This causes the CNS produces more serotonin as a result in response of the serotonin receptors.
To understand how sumatriptan treats migraines, we need to first understand the mechanism of action of sumatriptan. As we can recall, sumatriptan is in the pharmacological class of selective serotonin receptor agonists. That means it is an agonist of serotonin, specifically the 5-HT1 receptor subtype. If we can recall from our lessons, agonists, through the representation of the lock and key explanation, they bind to the target receptors and induce a biological response from them. In turn, this creates relief from migraines by acting selectively at the 5-HT1D and 5-HT1B receptors located in the sensory nerves of the trigeminal system as well as the intracranial blood vessels. In turn, this causes vasoconstriction and inhibits neurogenic inflammation from plasma extravasation, which causes the buildup of fluid, giving quick relief from the pain of an acute migraine. And as we can understand, the onset of oral sumatriptan only takes 30 minutes. Here, we have a visual representation of where the mechanism of action of sumatriptan takes place. From the onset of the migraine, the patient will take 50 mg of oral sumatriptan, which will then be absorbed through the gastrointestinal system incompletely from 14 to 15% absorption, where it will then be circulated through the circulatory system, where it will penetrate the blood-brain barrier to enter the brain. Here, the target receptors, known as the 5-HT1D and 5-HT1B receptors, where the agonists will bind to them and cause a biological response, which will cause vasoconstriction, reducing MCA dilatation. The MCA is also known as the middle cerebral artery. It will also cause the reduction of neurogenic inflammation, which reduces pressure in the brain. Therefore, from these effects, the patient will get quick relief from migraine symptoms in only 30 minutes.
Next, I am going to talk about the instructions of use of sumatriptan 50 mg tablet. You can start by taking 50 to 100 mg of sumatriptan tablet as soon as you notice any symptoms of migraine. If the initial dose was somewhat effective, but the headache reoccurs, you can take another dose after a minimum interval of 2 hours. After taking the initial dose, if there is no reaction, you cannot take another second dose at the same episode. This medication may be taken with or without food. And lastly, the maximum dose for an adult of this medication is 100 mg per dose and 200 mg within 24 hours.
Next, counseling points for migraine management. There are 3 points that I would like to share, which are headache diary, healthy lifestyles, and dosing limits. Firstly, headache diary. You should find the possible migraine trigger. It could happen due to your meals or activity, so every time you got a migraine attack, you should record it in your diary. On top of that, it can help you to know more about your migraines. You can see its pattern, like how often the attack occurs and how frequent you take the medications. Next, healthy lifestyle. Firstly, you should sleep well by setting up a regular sleep schedule. For an example, you should sleep and wake up at the same time every day. Besides, you also can check what you eat before sleep and make sure do not eat any food that can interfere with your sleep. Secondly, eat well by avoiding eating food that can trigger your migraine. When you suspect certain food might be the reason of your migraine attack, you can try to remove it from your daily meals to see the effect. Lastly, you can manage your stress by managing your time through schedule. That way, you might be able to reduce the likelihood of migraine attack. The third point is dosing limits, where you should remember that second dose of medication may be administered, but only after minimum of 2 hours has passed in 24 hours. And remember, not more than 300 mg should be taken in 24 hours period.
Now I shall present the adverse effects of sumatriptan among patients. Generally that sumatriptan's medication are well tolerated and effective against migraine cases, but at some cases it can cause several adverse effects, whether it is common or rare adverse effects. To be alert that this medication should not be used by patient or should be avoided by patient with hypersensitivity, previous myocardial infarction, ischemic heart disease (IHD), and severe hepatic impairment. Some common adverse effects that I should highlight for patients that taking sumatriptan is it may cause mild blindness, hypertension, which is the elevations of blood pressure, chest tightness or heaviness, flushings or redness of skin, especially around face and neck, increased blinking of spasm of the eyelid, itching, sensation, pain, redness or swelling, feeling the lightheadedness, dizziness, or sometimes can cause fainting, and it can also cause nerve pain.
That's all from us, and thank you for listening.